Hi, Dr. Fuehrlein. Thank you for joining us today.
My pleasure.
Really appreciate you being here with us. So for the better part of your career, you've researched and treated people with addictive disorders. What really sparked your curiosity in this industry?
Yeah, so Phil, that's a great question. I mean, when I was a third-year medical student at the University of Florida, I rotated on an addiction unit. And the addiction unit treated people who were detoxing from substances. And there were a lot of professionals and people that I could relate to who were really suffering with addictions.
Yeah.
When I rotated through the unit and I started to talk to the patients about their addiction and about their drug use and about their life, it was fascinating that people would be willing to give up everything that they have to drink alcohol or to use drugs. And when I could really spend time to talk to them and ask them questions about their history and their drug use, it was totally scientifically fascinating why people would choose to go down the path of addiction or how they wound up going down the path of addiction and how that happened. But also to see the treatment was more than just checking labs and giving IV medicine or following an algorithm. The treatment was very much you using your personality and your style to motivate someone to get better. And the mentors that I worked with at the University of Florida did a great job at trying to connect with people when they were at their worst to motivate them to get better, and used all different strategies and techniques. And when I work with my patients now, I'm able to employ all kinds of styles and techniques that are hard to learn and teach, but it's sort of a personality and a connection that I can make with patients. Again, beyond checking the potassium and checking the sodium and doing, I just think addiction is scientifically fascinating, what makes people do the things that they do to feed an addiction, and how the treatment is so personal and how you have to connect with people in order to get them better.
That's excellent. So now, as the leader at Yale in this, with this group, and you're passing on this information to the new generation of medical students, what do you find most important that you want to make sure that they know about, that they take into their careers, no matter what specialty they have?
Yeah, so I work with third-year medical students. I work with first and second-year medical students by lecturing. I work with first-year podiatrists,
Wow.
who have very little mental health training and never will again.
Right.
I work with first-year residents, second-year residents, third-year residents, chief residents, and fellows. So I cover the whole gambit of trainees at Yale. And my goal for all of them is to understand the process of addiction and to understand why people with addictions behave the way that they do, and to help them to have empathy to work with patients who have an addiction, and to understand that this is a lifelong process, that they need a dedication to treatment in order to stay well and to get better. You see in medicine all the time, especially outside of psychiatry, where there's negative feelings and negative emotions towards the patients who abuse substances and drink. But if you can understand how the patients wound up like that and understand the disease process, then maybe I can spark some empathy and to try to get the medical students to work with the patients better and to hopefully treat them better down the road. Most of the students I work with are not going to go into psychiatry and are not going to go into addiction. All the residents I work with are in psychiatry, but they may or may not go into addiction. Obviously, the fellows are interested in addiction. The vast majority of the trainees that I work with do not go into addiction, but I want them all to understand enough, because every one of them will see patients who are addicted to something unless they go into a specialty where they don't see patients.
Right. So, that really allows you to really permeate the industry with people who, that this is really an epidemic. So you're able to spread this information across many different fields. Now, you've really adopted the research practitioner model, because as you're a faculty member, but you're also a clinician. And you're the head of the Psychiatric Emergency Room at the VA in New Haven. And so what does like a typical day look like in that setting?
So, my job is very sort of multidimensional. I'm a clinician, and my obligation is to the clinical care for all veterans who come to the VA Psychiatric Emergency Room in crisis.
Right.
So my job is to take care of them. So often I see the patients, but other times I have to supervise the people who are seeing the patients, so I have a lot of trainees with me. So I supervise the residents, the students, all the trainees who see the patients, but I'm also responsible for the administration of the emergency room 24/7, and that's a lot of doctors who are not trainees, who are attending physicians. So part of my job is clinical, part of my job is administrative, and a lot of my job is teaching, where every day I have students, residents, podiatrists, nurse practitioners. Every day there's people who work with me who I'm able to sit down and mentor and teach about what I want them to know about emergency psychiatry, but also primarily addiction. And I do some research, and I do a lot of collaborative stuff with other people who are looking at things like disruptive behavior, opiate use disorder, alcohol detox. These are all things that I'm also interested in publishing on teaching. So these are all things that I'm interested in. But I'm very lucky to have a job where it's sort of multidimensional, where I teach, I'm able to do some research, I'm able to administrate in ER, and I'm able to actually do direct patient care myself.
Well, you're having to coordinate a lot of different departments and government agencies and medical staff. What really inspires you to do this wonderful work that you did?
So one of my favorite things about the psychiatric emergency room is everybody knows us, right? Every outpatient doctor at some point will send a patient to me, okay? Police know us very well because they bring us patients and they're involved with things. The inpatient teams, where there's codes, meaning patients are disturbed on the unit and they have a behavioral problem, they call us to go up to the units. We're on the code team. At some point throughout the year, I will have an opportunity to interact with virtually every outpatient psychiatrist, almost all the inpatient people, the police department. Pretty much everybody knows about the psych ER because it's a high-profile place. The chief of staff comes into my office to talk about high-profile things. That's one of the beauties of the ER, is to be able to work with so many different people and so many different departments, and to be able to manage it in a way that everybody respects what we do because of the high risk and high acuity of the veterans. But at the same time, I appreciate the fact that all of these people out there are willing to send their patients to me and trust that I'm going to take care of their patients. And you got to imagine, if you're an outpatient psychiatrist, you might have a load of 100 people, maybe 200. Your top 5 in terms of difficulty, those are the 5 that are going to come see me.
Yeah.
If you take all the outpatient psychiatrists, take their 5 most difficult patients, those are the patients who I see all the time. So everybody respects the work that we do because of how hard it is, and I get to know and to learn from and to work with all the people at the VA. So it's really rewarding.
Yeah. You really seem excited about your work and really have a passion for it. Is there anything else you want to share about that excitement and passion? Because you really are making an impact on this epidemic and using that integrative model, which is really on the forefront of thinking and treatment.
Yeah, I just want doctors, clinicians, nurses, social workers, people who work with patients every day who might struggle with an addiction. I want them to appreciate where the patients are coming from, and I want them to appreciate what it's like to be in their shoes and to have some empathy. I want family members to understand. I want the general public to understand this is a disease process. I want people to understand that this is not a choice. It's not something that should be punished. It's something that we need help, and the patients need treatment. I think it's very important for people like myself who are passionate about this to get involved with legislature. I'm working with some towns in Connecticut and giving talks to high schools and things like that. It's very important that people in this community and in this arena are able to get back to the community to educate people and to also let the community as a whole know that people who struggle with addictions are good people who have a bad problem, who need some help. So it's really great to come here and do something like this, to reach out to people here in this state, in the state where I live, and I'm really passionate about all of this, and I just really think that this is a great opportunity for all of us. And now with the epidemic, this is an opportunity for us to make a difference. This is an opportunity for us in this field who really care about addiction, who are passionate about treating people. Now that the media is covering it, the presidents are covering it, our local towns are worried about it, this is the time when we can make a difference to our community because people want a change. And that's not normal with addiction treatment.
This is a new opportunity, and the light is really being shined on.
It's a good
people
time.
like you.
Yep.
Really appreciate you coming and talking with us and coming to visit with us and give a wonderful presentation today. And for those interested in learning more about Lakeview, you can visit us at lakeviewhealth.com. You can also reach us 24/7 at 866-887 0142.